My name is Arthur Garson, and I'm the Director of the Center for Health Policy at the University of Virginia. I'm a past president of the American College of Cardiology and past chair of the Agency for Healthcare Research and Quality National Advisory Committee. It's also important that I give you a conflict of interest statement. I'm the unpaid chairman of the board of the Grandaids USA and International. That's Grandaids. I think the reason to talk about that is later we'll discuss Grandaids in context. My idea is to give it to you objectively, but you need to know that I have that conflict. Thank you. So we're here to talk about transitions of care and specifically readmissions to the hospital. And I think there's a myth out there, and that is that readmissions aren't important. The idea is, wrong thing to measure, can't measure it, bad idea. I thoroughly disagree with that. Readmissions to the hospital are vital. They're bad for the patient. Within 30 days, pick it, whether it's 15, 30, 60, 90, patients, unless absolutely necessary, should not be readmitted to the hospital. Now, we don't do any better as a country than most other countries. Somewhere around 20% of Medicare patients are readmitted to the hospital. Now that, fortunately, has gotten better over the last few years, and there's a reason for that. I believe the reason for that is that the Center for Medicare and Medicaid Services, CMS, has created a penalty. And we'll talk in a minute about the advisability of using some of the metrics. But the idea that someone had to put something in place to get all of our attention on readmissions, I think, is important. The 30-day readmission rate is obviously arbitrary. The idea, on the other hand, is a good one, that there needs to be a measure of a patient who is back in the hospital and who doesn't need to be back in the hospital. Now, what CMS has done is they've chosen all-cause readmissions, meaning if you break your leg, or as somebody yesterday told me, if somebody is shot, that still counts. Now, I believe that there needs to be a honing of what really is important in readmissions, and that's very difficult because people may game that. But the idea of trying to reduce or prevent readmissions, I believe, is a good one.